Michigan Medicine's Center for Facial Cosmetic Surgery. I am Lorena, and I'm here to help you bring in the fall season with our November special. It is Restylane fillers, all of them. And if you purchase one of those fillers, you will receive a free product. We'll tell you more about that later. But today we have a special treat for you. One of our very own doctors, Dr. Chaz Skukin, is injecting a patient with Restylane filler right now. So come on, let's go watch.
Hi, I'm Dr. Chaz Stukin here at the University of Michigan Facial Cosmetic Center, and we're here with Kim today. And Kim is a mom. She is a 3-year-old boy, and she is working all the time and always busy. And she has some concerns that she looks a little bit tired and has some lines around her eyes that bother her. So we've marked out an area of concern for her on her cheeks that we're going to use some filler on today. The filler that we're going to use is called Restylane-Lift. So Restylane-Lift, it has lidocaine in it as well. This is a filler that is composed mostly of something called hyaluronic acid. So hyaluronic acid is a naturally occurring substance in our skin, and this is a version that we can inject. The filler will stay in your cheeks, and we put it all the way down on the bone, all the way down here. And what it does is it kind of brings the skin out to lift up your cheek a little bit and to help hide some of the lines that we get underneath and around our eyes. It stays in there for approximately 9 months to a year. It kind of depends on the patient, but you can definitely get a good effect for at least 6 months. It's a really nice substance that has a really low rate of getting allergic reactions. Sometimes people might get a little bruised when we do these fillers. So first I'm just going to give you a little bit of injection of local anesthetic. And this filler actually has local anesthetic in it already, but I tend to put in a little extra. One thing that I do that's a little bit different than other surgeons is I use something called a cannula to inject the filler. A cannula is blunt tipped. So instead of using a needle to inject the filler, which has a sharp tip, I use a cannula. This helps to decrease our risk of complications. There are some really, really rare complications that you can get from filler injections. Avascular necrosis of the skin, which most people don't know what that is, but trust me, you don't want to get it. So blunt tip cannulas also have a lower risk of getting bruising. So you can see here, I can touch that, it's not sharp at all. So I just go in right at the site where I put the needle in before, and then we go down right onto the bone. You can see that this type of injection is a little bit uncomfortable for patients, but the good thing about it is that it's relatively quick. Really what it does is it adds a little definition to the cheek. Oh, sorry about that. Adds a little definition to the cheek and helps to fill in kind of the hollows that we get on our upper cheek as we age. This injection is deeper than most other fillers, so a lot of it is done by feel. After a procedure like this, patients don't really have any restrictions. We do ask them not to massage this area, but they can resume normal activities, go straight back to work right after this, or they can even see friends, and no one would ever really know that they did anything. So that's it. You can see it just took a couple minutes. Now I'm going to massage it a little bit to make sure that I put everything in the right spot.
Wow, that was so cool. I hope you enjoyed that because Dr. Stukin is great. So we're going to give you the product of the month. So if you buy any of our Restylane fillers, you will receive a Cooler Matte product. And we have Susanna who's going to give you more information on that.
Hey Susanna.
Hey Melanie.
I have a couple of questions about the product we're featuring this month, the Cucumber Mineral Sunscreen by Kula.
Sure, what can I help you with?
Is this a good product for me? Would you recommend this?
Actually, I would. It's a really nice product that has a physical blocker as opposed to a chemical blocker, and the reason I'm telling you that is because I know your skin is a little bit rosy. You've got a mild, very mild case of rosacea, but the fact that it's a physical blocker as opposed to a chemical, it'll be a much gentler protection for you.
Sometimes I'm really dry. Would this still be okay during those months?
It would. So even though, again, this product is geared more toward combination and oily skin types because it is a matte product, for you, you could definitely still use this. All you would do is layer a moisturizer underneath and then apply this on top. So it has a very light hydration that might not be enough for you, and that's why you would layer a moisturizer underneath.
Okay. So would I use this every day then? How do I use it?
I would definitely recommend using it every day, even on the days that it seems a little bit cloudy outside. We're still getting rays of the sun through those clouds. So
Right.
you could use it daily on its own, or you could actually layer this under makeup because of the velvety texture that the product has. It actually acts like a really nice makeup primer. So
Oh.
everyday use would be perfect.
Okay, Susanna, this was so helpful. I think I'll purchase the product.
Okay,
Thank you so
sounds
much.
good. You're welcome.
Thank you so much for watching this month's special. You got to see our very own Dr. Chaz Stukin. You got to hear from Susanna. And now we are saying, call us, come in, get you some Restylane, and get a Cooler free product. We appreciate you and see you next month.